Assalamu alaikum wa rahmatullahi wa barakatuhu, our most cherished viewer. Welcome once again to Health Check, a program where we give you medical advice on how to tackle certain ailments regarding our health, health or lives. With me today, I'm joined by Dr. Baker Akaturinda. Dr. Baker, most welcome.
Thank you, sir.
Dr. Baker is going to be taking us through the topic of discussion today, which is monkeypox, a disease that is making headlines today in East and Central Africa. What is monkeypox? How does it spread, and how to avoid it? All today, that is what we have to learn from Dr. Baker Akatulinda. You're most welcome once again.
Thank you. It's my pleasure to be here.
Thanks for always honoring our invitation. And straight to the point. What is monkeypox?
Yeah, thank you once again. Monkeypox is a viral and zoonotic disease caused by monkeypox virus. What do I mean? When I say viral disease means it's caused by a virus. So it is not caused by bacteria, not caused by anything, but caused by virus.
Okay.
Then we say it is zoonotic disease. Zoonotic means it is spread from animals to human beings. So it begins in animals. It began from animals, moving on to human beings. This monkeypox virus is the cause.
Wait a bit. It comes from animals to human beings.
Yes, yes.
The name itself is monkeypox.
Yes,
I quote that, monkeypox. I thought it comes specifically from monkeys.
Yes, yes. From monkeys to human beings.
Okay,
now.
okay.
Yes, yes. So it is, the virus derives its name from the source of the disease, monkeypox virus.
Okay.
Related somehow to the smallpox virus, but is less severe than the smallpox virus. But it's also a dangerous viral disease that needs to be tackled and avoided as much as possible. It was first discovered in 1980 in monkeys. And the first human being manifestation to be noticed was in 1970, just in our neighboring country here, in the Democratic Republic of Congo.
Yes, yes, yes.
So that's
actually
when
there I hear our brothers there even eat monkeys.
Oh, well, that is serious. So in the year of 1970 is when the first human being was diagnosed with monkeypox virus in our neighboring Democratic Republic of Congo. But originally, this virus was detected in monkeys in 1958. So you can see that time lapse, that time lag. But finally, the virus got its way into humans. Like you said, it is a zoonotic disease. It spread from animals to human beings. Yes.
So it's not a new disease.
It's
anyway.
not a new,
Yeah. From the facts that you've given me and the history, and when it was discovered here, we are bordering with Congo, in the east. Is it east? Yes, if I'm not mistaken. Since it's not a new disease, it is known. Actually, it is making headlines at the border of Uganda and Congo right now. Congo, Rwanda, Burundi, Uganda, South Sudan is making history. I mean, it's making news, headlines. How does it spread?
Yes.
How does monkeypox spread?
Yeah, very important. Now, this is not a new disease, like you said, but it has having some outbreaks in non-endemic areas. So it's important to tackle it. Now, the spread of it is, like you said, from animals. It began from animals to humans. So it comes from animals to humans. For example, rodents, monkeys, those who hunt, they can get from those animals. Those who go to hunt in the bushes, they get animals which are infected by this virus. They touch them. Some of them eat the meat. You know, people used to say they eat some monkeys in Congo, something like that.
Yeah, they do. And actually, I wanted to ask you a question. How safe is it to consume or eat monkey meat?
Depends on the culture, because some societies don't eat monkey meat. But in medical, for us, we say any meat you are eating, you should ensure that it is properly and properly cooked. So as if there is any infection in it, it is completely wiped out.
Okay.
Yeah, so it is also important. So we are talking about the transmission. So from animals to humans, those who go to hunt, who have rodents and what. Then also now it is a big challenge here. Now from human to human.
To human.
Much as we say it is a zoonotic disease, so it is from animals to humans. But once it has now entered a human being, this human being can share with another human being.
So it can be contagious.
Very contagious. Not can be, but it is highly contagious.
Wait, doctor.
Yes.
In our day-to-day or everyday interactions with our fellow human beings,
Yes.
in the markets, in the football stadiums, at schools, does it have to be a direct contact, or the interaction that we're having right now can spread it?
Oh, thank you. That's what I was coming to. Now, the spread from human to human, one person to another, can be either through respiratory, that's droplet infection. If a person can cough
or sneeze,
those we call them droplets.
Okay.
They can transmit the virus to another person.
So when someone sneezes or coughs and a drop touches this table, I touch this table,
Thank you.
I can be infected.
Good. Very well. So that's a way in which it can spread from person to another. And also skin-to-skin contact. You are touching a person has sweated maybe, then the sweat enters you.
So it's like hepatitis B.
Yeah.
Even when I wear the same clothes that you wear, I can still have
the same clothes, beddings, handkerchiefs, wearing those capes. The capes we share, wearing shoes.
I can see now why it has been making headlines.
Yes. So it is very contagious because it is easily spread.
Okay.
You may avoid putting on a person's shirt, but you can be near them and they cough and you share, because we said it can move by respiratory. You may avoid that, but maybe you greet a person in the hand who has, then you share. Those who maybe who work, perhaps doctors, who touch patients and what, they can easily get this monkeypox virus. Those who forget or deliberately don't use gloves and they touch patients bare hand, they can easily get this monkeypox. So it is the worrying cases are from a human being to a human being. The greatest worry is not from animals to human beings. That can be controlled.
Okay.
But now, controlling human beings is the challenge. So from you...
I had a question there, doctor.
Yes, doctor.
How about through the air, as we are speaking right now, okay? The air I'm exhaling, can it be a disaster to you?
Yeah, true, absolutely, yes. That's why in congested areas, like we talked about schools, mosques, churches, gatherings.
So this means whoever is infected needs to be quarantined.
Yeah, yes, true, absolutely. Actually, we shall check it in the treatment options. There is isolation.
Okay.
Because the person is coughing, sneezing, breathing, and those who are near him are sharing these viruses.
Okay.
So it is very important to understand the ways through which this monkeypox virus is transmitted, because we say it is highly contagious. So once a person gets it in a room, a big number will share of it.
Okay.
Yes.
So now let's go to the symptoms. How can we tell that such and such a person might be infected with monkeypox, depending on what we see?
Yeah, now, like we said, this is a viral infection, and this is more of respiratory manifestation. So it first presents with flu-like symptoms. The symptoms are more like flu. A person first gets some headache, it's on and off, gets some fever, feverish, is feeling some hotness in the body. It can come and go. Then some of them can get fatigue. You have not worked so much, you have not done heavy work, but you feel you are so tired. You feel you are so tired every time you are tired. You want to sleep. You get somewhere, you want to lie on a chair, you want to lie down. say, I have some little flu, some little flu. Actually, most people say, I got some little flu these days, some little flu. When sometimes actually, when actually it is monkeypox virus. So they can have that. And also there is a distinctive symptom, which you call rash all over the body. It can begin from the face, yeah, spreads to the head, to the neck, to the chest, then it goes to the whole body parts. And this is now distinctive in that it will tell us, it will show that now typically the person has monkeypox virus. So these rashes can first be mild, but they can continue progressing until when they even make blisters. So we can see these symptoms and we can tell that the person has monkeypox.
Okay.
Yes.
From what you have explained, doctor, the little I know about smallpox, it's something similar. How can one differentiate these symptoms, the ones for smallpox and monkeypox?
Yes, thank you. Now, like we said, the monkeypox virus is kinda, okay, it has very many similarities with the smallpox virus. So monkeypox disease is almost resembling smallpox. So many people may fail actually to differentiate them. But much as all the symptoms are almost the same, flu-like symptoms, headache, dizziness, what, but the differentiating symptom is lymph nodes, swollen lymph nodes. In smallpox, the lymph
What
nodes
are the lymph
swollen.
nodes?
Lymph nodes are, okay, we can explain it in a simple language to say they are parts of the body where the lymph is concentrated. For example, in the neck, in the neck, it can be there. In the armpits, there are lymph nodes there. Then in the thighs, it is in the inguinal region, between the thighs, it is there. The lymph nodes are there. Now, when a person has monkeypox, those lymph nodes are swollen and painful. From there, we can differentiate and know that, oh, this person has smallpox. Yes. Remember, we said in the introduction that monkeypox is almost similar to smallpox, but for smallpox is more severe than the monkeypox. Now, the severity is displayed here by the swelling and the painful lymph nodes, like I was explaining.
Okay.
Yes, please.
Thank you so much, Dr. Baker. For the times I've invited you here, there's something I learned from you. Prevention is cheaper, cure is more expensive. Yet everyone knows prevention is better than cure. So how can our African people prevent themselves from contracting this virus?
Yes, thank you so much. I once again repeat what my moderator said. Prevention is affordable. Prevention is cheap. Prevention is the way to go. Cure is very expensive. Cure is very complicated. Cure is, I will not say not the way to go, but we don't prefer cure. We would prefer prevention. So now, since we know that monkeypox is greatly contagious, let's look at ways of now preventing it.
Okay.
Because we shall be better when we prevent a disease before it happens. One, vaccination. Vaccination is introduction of a vaccine in the body to prevent it against a certain disease. Now here, you get a shot for monkeypox, and when you are exposed to this disease, you will not get it, it will not disturb you. So we should do vaccination for high-risk populations. What are those ones? For example, okay, there are those people who are at high risk of getting this monkeypox. Like I was explaining and I said, health workers, some of them are in the health facilities which have deficit due to funding, and they have less medical equipment. They have less protective gears. Some patients are sometimes some hospitals have more patients than gloves. So a doctor sometimes is forced, having no option, to touch a patient without having a glove. Then I said, this doctor can be at a high risk of getting the monkeypox. Therefore, we now do vaccination for health workers.
Okay.
Another category of high risk populations are those who are immunosuppressed. Immunosuppression, I mean, they have less immunity. One time I mentioned here before other shows, and I said, people who have chronic illnesses like hypertension, who have HIV, who have hepatitis B, those viruses reduce their immunity. And therefore, when the monkeypox comes, it finds a good ground now to take over.
Okay.
So it is very important that now we vaccinate these immunocompromised patients, immunocompromised people, to boost their immunity now, so that when the monkeypox knocks on the door,
the body has enough soldiers to
fight
against.
back and kick it away.
Okay.
Yes. Then also, we can do what you call hygiene. Hygiene is very important because we mentioned and said this monkeypox is highly contagious from a person to person. Now, I mentioned and said we shake hands every day, and when you shake hands with a person who has monkeypox, you're also at a great risk of getting it. Now, hygiene helps us here in that when you wash hands regularly, perhaps you not share from a person. When we encourage our people to wash hands, all of us, it means a person will greet you when you have just washed hands. The sweat will have gone away. And in doing so, you will not transmit this viral disease, the monkeypox virus, to him. And also, other ways of hygiene are washing clothes regularly, not sharing clothes. After washing clothes, we try and iron them, because now the heat from the ironing kills the virus. Another way is that we try to keep our beddings clean and we don't share them. This will help us to minimize this monkeypox. And also, there is a point in prevention which is very important, creating awareness. Mm-hmm. Many people may not be having the knowledge of how this disease spreads. And actually, this program is doing one of the best ways of preventing by creating awareness to you, the viewer, for you to be aware what monkeypox is, what are its causes, when it started, how to prevent it, how it presents, signs and symptoms. So creating awareness is very, very important in preventing this monkeypox virus disease.
Okay.
Yes.
Thank you so much, Dr. Baker Akaturinda. The program is even getting much more interesting as we getting closer to its closure. Doctor, let's talk about now the process of the hospitalization. When it comes to hospitals, when it comes to treatment, yes, exactly, yes. That's what I need to know. Which treatment do you have for monkeypox?
Yeah, thank you so much. The treatment, first of all, is identify the patient. Very important to identify. After creating the awareness, like we said, now it is now incumbent upon us and the society now to check and tell this patient who has monkeypox and rush them to hospital for management. Okay. Now at hospital, the doctors will examine and tell if the person is in mild conditions, they can give supportive treatment. We tell them to take vitamin C, to drink fruits, to drink parenteral fluids. We can give the paracetamol to the person who has headache, paracetamol, fever, supportive treatment. We're just encouraging the body to get strength and fight this virus. Also, we have what you call antivirals. Antivirals are drugs which fight viruses. Okay. Since this disease is viral, caused by a virus, we give drugs which counter viruses. They're called antivirals. An example is called Cidofovir. There are also others. There are kind of many. So we give those antivirals to help combat this monkeypox virus.
Okay.
What I cannot forget is isolation.
Okay. Yes.
In treating or managing this, because you may take a person to hospital who has monkeypox 1 and infect the whole ward.
The entire ward. Yes.
The entire ward, yes. Now you had the 1 patient, now you have 100 patients on monkeypox. So, and you may not manage to handle all of them because of the capacity that we have in Africa, our hospitals, our healthcare system. You know, Africa is still lagging behind in supporting the healthcare system, unlike those Western developed world countries. So you take 1 patient hospital, you get 100. You fail to manage them and you have challenges.
You have thousands again.
So now the best treatment is at hospital, isolation. This patient is, like you said, quarantined, taken to his own private room and managed from there until when he or she recovers fully, recovers from the disease, and they can be able to be taken to other people now when they can no longer transmit. Remember, a person is able to transmit a disease. Let me put it better. A disease is transmittable when the number of viruses in the body reaches a certain level.
Okay.
I repeat, a disease is transmittable if the viruses in the body have accumulated to a certain level.
Okay.
So if the body has fought it and fought it and fought it to a lower minimum level, the person can be in society and they cannot
not
spread. Yes. So after isolating this patient, we manage and handle. When the person improves, he can be set free.
So by this you mean it is curable completely?
This question is kind of tricky, but viral diseases do not heal. This is very, very hard, but viral diseases do not heal. Even the flu, you see, flu does not heal. The body overcomes it and keeps it under check. You may have it actually in the future, but it will not affect you. So this can be fought completely and the person will not get again.
But it's still in the body.
It's still in the body, but in minimal and minimal amounts that cannot.
In other words, the body cells can bear it.
Let me say the body cells have overcome it.
They are at top of it.
Yes, at top of it, overpowered it. The quantities, the small remaining viruses are very minimal that they cannot do anything. The body cells just keep them in check. They can't do anything. Okay. They cannot even be transferred to another person.
Okay.
So for us people will say this person got cured. But for us in the medical
that's what they see.
Yes, yes.
But medically,
for us medically, we know this person had this viral infection and still has the infection.
Let's go a little bit off topic, because now you're scaring me. We donate blood every day.
Yes, yes.
If I was once, because I have a friend of mine in Dubai, he said because in Dubai, when you go in Dubai, once you're diagnosed with malaria and you are given medication, in Dubai you do not donate blood. Okay? My question is right now, should I assume that once I'm diagnosed with monkeypox, you, the doctors, I don't have these other STDs or these other AIDS diseases, can you give my blood to someone that is negative when it comes to monkeypox?
Well, it's a broad question, but blood is given most times in emergencies. Actually, a person would not get blood if they are not bad off.
Yes.
So let me give you an example. There has been an accident, for example. A person is bleeding to death. Now, a person is going to die. We just give this blood. Thankfully, this thing does not kill because it is controlled. Okay. So we give the blood. Now, I may not comment about the Dubai policies and what, because every country has ministries of health. Yes. So the Ministry of Health sits down, carries out a research, and they come out with their own resolutions and decisions. Okay. But usually, we give blood when it is a matter of life and death. A woman, for example, has given birth and she's having PPH, bleeding. We say person going to die. There's blood there we give.
Because what I know, the blood is tested. That is for sure.
Yeah, they test everything.
Yeah.
Yes, yes.
If the disease that is found in that blood can be fought and curable, then there's no harm in giving it
Yeah,
to another
there is no
person.
harm. There is no harm, actually. There is no harm. Because, okay, you see, there are several severities of diseases. Like HIV, that's very dangerous. You get it?
Yeah.
But now this one, even your body can overcome it, and some tests may not get actually. You need some complicated,
Actually, from what
tests.
you've explained,
Yes.
some people with good immunity system can even get this disease and don't even know that I have monkeypox.
Thank you. Actually, very many people in Uganda have monkeypox disease, but they don't know it. So what I told you about those who say, I have some flu. Most of them actually have. I'm sorry to say, even you may be having it when you don't know. But now, if your body is strong, the body soldiers will get their guns, point them on the virus, and tell it, keep there. Don't
Many
spread.
of us contracted the COVID-19 virus, but we were very okay and actually didn't know we had until many of us went to hospitals for checkup. You went, you're very fine, and the doctor says, no, you need to stay here. You need to stay for quarantine.
Thank you. That's the point. So much as the monkeypox is not COVID virus, but viruses are like that. Yeah. If your body is strong enough, you can actually, the body soldiers can fight this virus and keep it in check. The challenge becomes when you acquire now another disease, and the soldiers are.
Thank you so much, Dr. Baker Catherine. We have went very far because I assume you had a lot to learn. That's why I had to ask many questions. Even I had to go off topic because I personally wanted to know these questions. And since I represent you, I assume that you as well needed to know more about the monkeypox and the little side, I mean the little bit outside of it. For today, let's call off our program for now, but we have a good chance in the near future, we shall again come back with more topics that will help you overcome the ailments or the diseases, whatever the case that you have at home. Remember, this is just medical advice. This is not treatment. This is advice on how to overcome. We always request you to go to your own medical personnel for more detailed information. I remain your host, Namba Ali Bashir. Assalamu alaikum wa rahmatullahi wa barakatuh.